Alright, good morning. I'm going to do an Ezpap. So the first thing I'm going to do is check the patient's chart. Then I'll knock on the patient's door and introduce myself, and then check the ID band. And when I'm ready, I'll wash my hands, and then I will assess the patient. I'll listen to the lung sounds and check the vital signs, make sure everything looks okay before I begin. And then I will get them ready, and I'll explain to them what an Ezpap is. So here we have an Ezpap. This is a positive pressure machine here. So this is just going to help you kind of clear up the secretions. This will help loosen up anything. It'll help you keep your lungs strong and healthy to get those secretions out. So here I'm going to connect a pressure manometer. So that's just going to check your pressure of how well you are breathing in and out, and if you have a strong enough flow, and if your flow is not quite strong enough, then we'll continue to practice with this treatment. So here we're going to connect it. There's a couple ports, so the smallest port will connect the pressure manometer here, like that. And this one connects to an oxygen source, so we just have the oxygen tubing here. We'll connect it to the oxygen, and then we'll set it up to the Thorpe tube over here, and we'll set it at 5 liters per minute. We don't want to exceed their inspiratory and expiratory rate that they can do, because then it can hyperinflate their lungs and it can make them hyperventilate. So when we are ready, we'll instruct them to do a 1 to 3, 1 to 4 ratio. So we'll have them breathe in and exhale at least 3 to 4 seconds. So we'll have a mouthpiece on the end here, and if they can't do the mouthpiece, we can find a mask that can also be connected to it to help them get that, be able to do the treatment. So when we're ready, we'll instruct them to hold it like this. We don't want them to hold it upside down, because if they hold it upside down, it's not going to breathe properly and it's not going to do what it's supposed to do. And so we'll have them make sure they know that they cannot occlude the ending piece, because then that won't get the positive pressure that it needs. It's going to cause back pressure, and then it's not going to work properly. So we're going to have them do a nice deep breath in, then exhale. Then they'll do that a few times, and then we'll give them a break in between times, but we'll do this a few times in an hour, just that way we continue to open up their lungs and strengthen their lungs that way. And when we're done with the pressure manometer, we can remove this and dispose of it. And if we need to continue to do this kind of treatment with the Ezpap, we always need to make sure we cover the port here. We don't want to have any excess air in there to cause any different pressures throughout there. That way we know it's getting the proper treatment for them. And so when we are finished with this, we would remove the oxygen tubing. We would set it in a safety bag off to the side. That way we can do the treatment later. And instruct the patient that they cannot wash this with water, just to let it air dry, because we don't want to cause any bacteria or anything to build up inside. And along with the Ezpap, you can also connect a nebulizer treatment to it. You just have a T adapter with it and a medicine cup at the bottom for us to put the medicine in, for them to do that. And so when we're done, we'll just set that in a safe place. And then we reassess the patient. We listen to the lung sounds, see if they are, if it's helping their lung sounds, if it's improving it or not. And every time we do like an Ezpap, we always need to have them do a nice deep cough, so that way if they have any secretions that have loosened up, that way they cough them up and get them out of their lungs. And then if we need to take in a sample, then we will do get a sample cup for the lab, and then we would take it to the lab. And then we also chart down any of the specifications of the sputum sample. And so we'll check, after we check the vital signs and everything looks good before we leave the room, I'll remove any PPE, wash my hands, and then I would go and chart on the patient's charts.